Hello, everyone. I'm Phil Diamond, the spokesperson at the U.S. Embassy in Kampala. I'm pleased to be joined today with Godfrey Nsereko. Godfrey, thank you so much for joining us. He is an alum of Uganda's Public Health Fellowship Program and has been doing some great work when it comes to the health sector in Uganda broadly and specifically in response to the challenges of the COVID-19 pandemic recently. So he's going to join us today to talk some about that. Um, I'd like to start out just with the first question. Godfrey, if you could just briefly introduce yourself and tell us what it was like to be a fellow on Uganda's Public Health Fellowship Program.
Thank you very much, Phil. My name is Godfrey Nsereko. I'm a public health specialist. I'm also a fellow of the Uganda Public Health Fellowship Program. I'm an alumnus. And also currently I'm an epidemiologist with the Ministry of Health in the Department of Integrated Epidemiology, Surveillance, and Public Health Emergencies. So I should say that my 2 years, that is 2018 to end of 2019 on the fellowship program, were really, I should say, some of my formative years into public health emergencies and surveillance. It was really an opener for me, given my previous background. I'm a pharmacist by undergraduate qualification. So after I went into public health, I was so much interested in public health leadership and field epidemiology. So I should say that the fellowship was my pivot for my turning point, basically into public health. And if I look back on some of the experiences on the public health fellowship program, the program basically grills us, and I'll use the word grills us, to become an overall public health leader. When I look back, I was posted in the Ministry of Health under the National Malaria Control Program, specifically the section for surveillance, M&E. I think it was really a great experience planning for the countrywide net distribution, which has just started. We are also greatly involved in policy development and guideline development, especially on epidemic preparedness and response for malaria. So all these experiences have basically enabled me to fit in and make the contribution that I'm making towards the COVID response as an epidemiologist with the Ministry of Health. It was really an endearing experience, and I think it was a real turning point for me.
Great, thank you. So maybe going back to before the fellowship, why did you choose to apply for this program and ultimately decide to participate?
Yeah, before the fellowship program, I was working with a non-government organization, but what I realized that there was a lot of need for public health leadership. I used to attend a number of meetings here and there in the ministry representing the organization, and I felt that I needed to also be part of the workforce that can create a change, especially around public health leadership. So during my Masters of Public Health, which I completed before coming to the fellowship program, as you know, it's a postmasters program, I developed a desire for epidemiology and surveillance. When I saw the opportunity, I felt that it was my entry point into that arena of public health. For me, the fellowship was first of all an entry into public health leadership, but also into working with the ministry. As you may know, the Public Health Fellowship Program is a training in service where 80% of the time and effort is basically dedicated to working closely with host institutions, which are departments in the Ministry of Health. And only the other 20% is basically academic or didactic training. So it's a very good entry into the system. And remember, the overall goal of the Public Fellowship Program is to basically contribute to disease prevention and control through building a solid and robust health workforce, public health leaders who will be able to assist the country and the world globally in basically detecting, preventing, and also responding to public health emergencies.
Switching gears a little bit more to the present and the COVID-19 pandemic, which is dominating the news. Could you tell the public some about the current roles that you are playing in response to the COVID-19 pandemic?
The COVID response is structured, first of all, at national level through the National Task Force and the Incident Management Team. And then each of the districts also has a district task force, which is basically a replica of what is happening at the national level. So currently, I am I work with the incident management team as a situation room surveillance coordinator. So basically, surveillance in COVID-19 entails a number of issues, and it can start from alert management, how people call in to call centers, how they call into districts about suspects, about feeling like they have signs and symptoms of COVID. So that is the alert management bit and how we respond to those alerts. Then there is the issue of port health, basically looking at the various points of entry, whether we are screening the travelers coming in, whether we are taking off the lab specimen and they're getting tested and they're getting results back, and also seeing that there is a capacity built in terms of training, in terms of human resource at the different points of entry, because as we know that Uganda is a landlocked country and almost all our neighbors are reporting high COVID numbers. Then the other issue is around contact tracing. This is basically trying to identify, list, and follow up all contacts to confirmed cases of COVID-19. And that is where my initial role was in this response. I'm a team co-lead in the COVID National Task Force contact tracing team. Here, basically, I've participated in constituting contact tracing teams for COVID-19 surveillance across the country, both centrally and also building capacity at the district level. Also ensuring that there are adequate resources. I've also participated in developing standardized tools for this contact tracing process. That includes the forms, guidelines, and also standard operating procedures. I've also worked closely with the surveillance leadership in the Ministry of Health to see that there is continuity of contact tracing, and also ensuring that I've helped to set up a data management system that closely monitors and also receives and aggregates reports that are coming in from all over the country regarding contact tracing. So, for example, to date, we have over 11,000 contacts, confirmed cases who have been listed. And this is no small feat. We have a team of about 40 people who basically work together with the district teams to see that this contact tracing is done. And I've played a role in that. So regarding the situation room surveillance coordination, I mentioned all the other aspects of surveillance. As a member of the incident management team, I provided linkage between basically the surveillance pillar of COVID-19 and the incident management team. So the incident management team is made of several pillars, and surveillance is one of them. We have laboratory, we have logistics, we have risk communication, we have case management, we have psychosocial support. So all these pillars, they have ICT and innovations. So all these pillars, the central linkage point is the incident management team. So what I also do here is that I coordinate daily reporting on all sections of surveillance. So I make sure that on a daily basis, the incident management team is aware of what is happening in alerts management, in points of entry health, in quarantine, and then in contact tracing and case investigation. I have to present the surveillance updates in the surveillance subcommittee meetings, and then we discuss on strategies. For example, currently in Uganda, we're looking at going into risk-based testing, whereby because we are having a lot of asymptomatic cases of COVID-19, we need to look at risk populations, and then we target testing such populations. I've also participated in strategy formulation, planning and implementation of surveillance pillar activities. So, for example, a month ago, I coordinated the reorientation of the district teams basically on the new surveillance strategy. And this has taken a lot of shape, and we are seeing a lot of improvements in reporting, in case detection, in responding to alerts across the various districts. I'm also a lead analyst for COVID-19 descriptive analysis to inform strategies. So with all these cases that are confirmed daily, I am part of the team that basically reviews each confirmed case before it is basically announced by the ministry. We check whether this is actually a true case. We check if the information that we have got from the laboratory is actually true, and then also on a daily basis, I have a team where we try to come up with basically descriptive analysis, epidemic curves, graphs, trends, basically to show us how the response to the epidemic is also is taking shape. I do a daily follow-up on surveillance subcommittee with the surveillance subcommittee on actions and recommendations of the IMT. So basically, that is a bit of what I do on a daily basis. On top of this, sometimes I be in the field and try to give support here and there on surveillance-related activities.
Thanks a lot. It sounds like you are very busy with the response, like a lot of the other fellows and people hard at work. Let me close with a two-part question. Any closing remarks you want to make? And then the second part of the question would be any advice you'd like to share with the public about how we can best prevent the spread of COVID-19 in Uganda?
I think I'll go to the second part. I've spoken a lot of really basically what I do. Yes, I appeal to fellow Ugandans and everyone in Uganda at large. COVID-19 is real. We've had challenges over the months because I believe, one, by the grace of God, but also by the effectiveness of our response strategy in a way, that we've not had a COVID death in Uganda to date. So there has been a lot of seemingly shift in the fear of COVID-19, where people tend to think that maybe it's not as bad as it is proclaimed. But my message to the public is that COVID is real. COVID is a killer disease. So the Ministry of Health has put forth guidelines on social distancing, on wearing masks. I don't have my mask because I'm alone here, but once I get to the public, it's mandatory for me to have the mask. So let us adhere to the guidelines. Let us follow the instructions that have been provided by the Ministry of Health, also with support with the partners, the National Task Force. Um, this is an illness which if uh, which we can defeat if we basically collaborate. And it's just a simple things like washing hands. Don't touch your hand, don't touch your mouth, don't touch your eyes, don't touch your nose. Keep a social distance. If you feel ill, please, we have the toll-free numbers. Call, we shall come to you. So basically, all this information is out there in the public, and I appeal to the public to adhere to it.
Well, Godfrey, thank you so much for joining us today, for sharing with the public your wisdom, what you've learned about COVID-19, and all the great work that you've done and are currently doing to respond to the pandemic. We thank you so much. The U.S. government is proud to be a supporter of yours and a supporter of the program, and we wish you best of luck in your continued work. So thanks so much, and we look forward to being in touch.